Good afternoon, and thank you all for joining us today. On today's briefing, we'll hear from Mayor Tom Barrett, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services with the Milwaukee County Office of Emergency Management, Darren Rausch, Health Officer and Director with the Greenfield Health Department, and Dr. Kristen Bensick with Bayshore Pediatrics and Children's Wisconsin. Mayor Barrett, I'll hand it over to you to get us started today.
Thank you very much, Catherine, and good afternoon, everyone. I'm happy to report that our gating metrics for this week show significant decreases in disease transmission. That's good news. We have moved from the high transmission category to the substantial transmission category for the rate of COVID-19 cases per 100,000 individuals. And in addition to that, we have moved from the moderate transmission category to the low transmissions category for percent positives. Again, a really solid step in the right direction. We are now at just 4%. The Milwaukee Health Department's gating criteria and analysis of trends has shown us that our strict precautions over the past 14 months, combined with the diligence of businesses and residents in following these orders, has moved us toward a return to a version of normal. And I think, again, that's good for everyone. We want to get back to normal. So beginning June 15th, Milwaukee will transition out of phase 6 and away from many of our mandated COVID restrictions. And I've already seen announcements today about events that are coming back on board and capacities are growing as people want to get back to normal. But I want to emphasize that mask wearing for those individuals who have not been vaccinated is still an issue. And we will continue to follow the CDC guidance for both indoor and outdoor masking. And I know a lot of this is in flux right now with an announcement from the CDC just in the last hour. I also want to stress, though, that this does not mean that the pandemic is over. We still strongly encourage the public to continue to do everything they can in their own hands. And what I mean by that, obviously, is vaccinations, 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 vaccinations. We need to continue our vaccination efforts to reach this path of reopening. And so I am again asking residents of our community. I just this morning saw a report that talked about the people who are hospitalized right now with COVID-19, and the overwhelming majority of those are people who have not been vaccinated. So if you don't want to end up in the hospital, get vaccinated. So right now we're at 38.2% of Milwaukee adults who are fully vaccinated, but we need to see this number continue to rise. Other good news this week, of course, is that starting today, 12 to 15-year-olds can now receive the COVID-19 vaccine. So those who are primarily in middle school and first year of high school can now get that vaccination. With a parent or guardian present, 12 to 17-year-olds can walk in and receive free vaccinations at the Wisconsin Center, as well as the Northwest and Southside Health Centers. I want to talk a little bit about our Financial Navigators program, because we are well aware that individuals throughout our community have been negatively impacted, not only from a health perspective, but from a financial perspective as a result of COVID-19. So for those residents tackling COVID-related financial challenges, the City of Milwaukee offers the Financial Navigators program in partnership with Riverworks Development Corporation, which is a local nonprofit that offers financial coaching and other services. These financial navigators and this initiative is a national model that helps residents deal with the financial impact of the COVID-19 pandemic, providing remote assistance over the phone in navigating critical financial issues and making referrals to other social services and resources. Since we began this program in October, 500 Milwaukee residents have received help from the Financial Navigators. So please don't hesitate to call 414-882-7440. The areas where callers are calling most frequently include questions about rent and utility expenses, managing credit card debt, and job search resources. But again, feel free to make a call to the Financial Navigator at 414-882-7440. Most calls last, about half an hour, about 30 minutes. And the services are free and available in both English and Spanish. Finally, last night, I kicked off my outreach effort with our ARP funding that's coming to Milwaukee. As we announced earlier this week, the city of Milwaukee will receive $394 million. That's down from the original estimate of $406 million, but I'm still immensely grateful to President Biden, to Senator Tammy Baldwin, to Congressman Gwen Moore, and others who supported this legislation. But I had a lot of members of my team talking about the ARP funding last night, getting a few questions, and we'll be doing more outreach in the days and weeks ahead. So we're excited about receiving these dollars. We know there's a lot of work to be done, but in areas like housing and broadband and early education and eviction prevention and infrastructure, we think there are some real opportunities here. So with that, I'm going to turn it over to County Executive David Crowley. Mr. County Executive.
Thank you so much, Mayor Baird, and good afternoon to everybody. I want to start today talking about some small business resources, particularly because we know that small businesses have been hit hard by this pandemic, and our community is reliant on small businesses and employees who work for those businesses. So I want to highlight a number of resources that are available to help business owners who are working to connect their employees to area vaccination clinics. And survey shows that employers are a trusted source of information about COVID-19. So the MMAC and the Medical College of Wisconsin developed an employer toolkit that can be accessed on the MMAC's website. And this toolkit shares steps about how what steps employers can take to answer their questions for employees and really get them vaccinated if they choose to do so. The Wisconsin Department of Health Services on their website is another great resource for employers looking to facilitate vaccination efforts among their staff as well. And the American Rescue Plan Act provides tax credits to small businesses that provide paid time off to their employees if they take time due to COVID-19. And so this includes time employees take off to get vaccinated, recover from getting vaccinated, visiting doctors to receive more information about COVID vaccines, or any other leaves taken in connection with COVID. And employers can play a key role in helping build vaccine confidence in our community, but it's important that businesses, especially our small businesses, are not financially impacted by these efforts. So we all can play a role in getting more shots in arms, and I want to encourage all of our local employers to step up and be a part of this important work. Getting more people vaccinated is a critical step needed for us to move forward and toward a path of economic recovery. And as the mayor mentioned, we are heading down a path, in the right path, and we're beginning to see some of the restrictions starting to ease up. But I want to make sure that because this information came out today, to let folks know that the Milwaukee County is evaluating both the city and the CDC updates to determine what this means for our county facilities and county grounds. And we will share more information as it becomes available, but we know that getting this vaccine is still our best tool to get over this pandemic. And it's important to state that the easing of restrictions, as the mayor mentioned, does not mean that we are out of the woods quite yet. So again, if you're on the fence about getting a vaccine and you need more information, please visit healthymke.com to learn more. You'll hear testimonies from community members, but you can also use it to locate vaccination sites near you. And I can't stress it enough, because every person counts and it can make a difference as we work to achieve greater herd immunity throughout Milwaukee County. So with that, I'd like to hand it over to Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. We have a lot going on today. So first, to our numbers, we're currently seeing an average of 95 new cases a day and about 1 death every 2 days. We continue to see encouraging gradual downtrends across the board, from cases and percent positivity to hospitalizations and deaths in the county. We did see a more gradual but continued downtrend in those seeking out vaccine for the first time, from about 1,600 per day a week ago, now down to about 1,300 per day. And as we see the city of Milwaukee take measured steps toward a new normal, we know that this is in the setting of these improved case numbers as well as hospitalization numbers. And we know without a doubt that these improvements are in the context of the vaccines that have been developed. As more and more members of our community get vaccinated, they're not only protecting themselves. Each individual vaccinated greatly decreases their likelihood of contracting COVID and nearly completely shields themselves from hospitalizations or death from the disease. So not only are they protecting themselves, but they're also collectively protecting our community. And that protection leads to the changes that we're seeing. It leads to more people going to Bucks games and Brewers games. It leads to being able to gather with family and friends. And it leads to the decision that the city laid out today and that the CDC did as well. Now, of course, it also leads to less people struggling to breathe in our hospitals and less people passing away from this terrible virus. Now, that said, we have a long way to go to the level of vaccination that will truly protect our community from COVID in the future. We're currently at about 42% of our county who's received at least one dose of vaccine. And we see significant disparities improve, but continue in regards to race and ethnicity, vulnerability, and geography of those who are getting vaccinated. We in Milwaukee County are lucky to have 3 vaccines that were developed by scientists and companies working around the clock to get us to where we are today. And the vaccines are incredibly effective. They're in fact so effective, and study after study has shown them to be so effective in real world settings that today, in addition, we're seeing new guidelines from the CDC. People who are fully vaccinated, that is to say 2 weeks out from completion of your vaccine series, no longer need to wear a mask or physically distance in most settings, indoors or outdoors. Now, there's some exceptions, such as certain areas with government regulations, or some workplace settings. But this is welcome news and further evidence of what we've known and are continuing to accumulate evidence and knowledge on. The vaccines simply work. All 3 vaccines make it far less likely that you'll get COVID. And in the very unlikely event that you have one of these breakthrough infections, it's rare, but occasionally it happens where somebody does get COVID, the disease is likely to be very mild in those who are vaccinated. But most importantly, the vaccines provide nearly 100% protection, 100% protection from hospitalization and death. And that is the key. We're entering a new stage in this pandemic, and a welcome stage, without a doubt. These vaccines have been a tremendous accomplishment in our country and in the world. And while many, many countries and citizens around the world are desperate for vaccine, we in the United States are privileged to have a surplus. And that surplus of vaccine leads to an easier time now to get vaccinated here than ever before. So please visit healthymke.com to find a location to get vaccinated. They're all across the county. Join those of us who are vaccinated and can now safely enjoy getting back to a more normal way of life. Thank you and stay safe, and I'll hand it to Health Officer Roush.
Thank you very much, Dr. Weston. It's my pleasure to join again this afternoon. I'll just start with some overarching comments about the data that really dovetail nicely to what Dr. Weston's already mentioned. We are continuing to see some positive improvements in our case data. Currently, we reflect a plateau to a slight decrease in COVID cases throughout the county. And that plateau is seen both in the city of Milwaukee and in the suburban communities. And while our 7-day averages in the suburban communities are a little bit less than the city of Milwaukee, the trending downward and even leveling off is a pleasant finding. For children, for the past several weeks, we've reflected increases in the children across the county, both in the city and in the suburban communities. I'm pleased to say today we're continuing to see some plateauing to slight decreases in those populations as well. And that's very, very notable and a notable improvement as we continue to move forward. And we'll monitor these changes very closely in the coming weeks and look at those trends. So with that, I'll go ahead and share the data so we can take a look at what we're seeing. And also today, we'll be highlighting some vaccination data that we've put together to give a sense of where we are in the vaccination world as well. So the first data figure today is looking at the number of new cases of COVID in Milwaukee County in our entire population. And again, we see this nice plateau and leveling off over the last several days, both in the suburban communities and in the city of Milwaukee. Now, when I flip to the kids report and look at cases in those under the age of 18, you remember last week we were kind of at this peak here for the city of Milwaukee 7-day average, and we've had a nice decrease there, and we've also seen a corresponding decrease in the suburban communities as well. So again, very favorable data in terms of cases very, very recently. Flipping back to the whole county report here, we've certainly have tracked deaths throughout the pandemic, and again, very notably for the last several months, due to very high vaccination rates in those most vulnerable in our community, we're reflecting very, very few deaths in the community, which is a very positive thing. We've talked about the transmission rate before, and I'm pleased to say that the reproductive number, that transmission rate for Milwaukee County, is below 1. We're just about 0.85 for the county overall, and trending in the right direction. And this week, for the first time in several weeks, the city of Milwaukee is now trending down, and the suburban communities are unfortunately trending up. So this variation is very important to follow and track, because we want to have that number be as low as possible to squelch the disease outbreak and the pandemics that we're seeing. The patterns that we're seeing in the data are very consistent to previous weeks. I will continue to point out that our 18-year-old population here, the red line in the upper right, is certainly very close in terms of total cases in surpassing the total cases for the 60 to 79 age group. So this is important because it really reflects that more recent, over the last couple months, increase that we've seen in our young children with COVID-19. Additionally, here in the lower left, I'll remark and reflect that the Black and African American total cases is very close to surpassing the Hispanic total cases, which is something that hasn't happened since the very first early months of the pandemic, and really reflects a growth in cases in the African American community over the last couple months. As Dr. Weston mentioned, testing data and percent positivity continue to trend in a very positive direction. We're seeing negative trends in percent positivity. We're seeing adequate testing, but certainly there's a lot of testing capacity available. We've had increases over the last 5 weeks, which is very good to see. And I continue to encourage people who need or want to be tested to seek out testing throughout the community. Lastly, on the case data today, I'll reflect and report where the cases have existed over the last couple weeks, just looking at where the new cases are existing in Milwaukee County. And again, this map looks very similar to what it looked like last week. So over the last 2 weeks, the areas in red and orange are the areas where we've had high COVID disease activity. And we see a little smattering of activity throughout the southern suburbs, but we see a lot of activity through the northwest side of Milwaukee, north side of Milwaukee into Brown Deer, and other suburban areas in the northeast. So with that, I want to switch now to the vaccine report. This is the first week we've put together as the epidemiology team here in Milwaukee County the vaccination data, and jumping on board of what Dr. Weston had shared before, vaccination rates continue to increase, and that's been a very positive sign. There's been a slight leveling off in the uptake of that vaccine, but certainly with increases in availability to adolescents 12 to 15, we will see more additional vaccines coming online and going into arms soon. So this figure just gives you a 7-day average of vaccinations administered to Milwaukee County residents, looking at the different vaccine types. And again, we've seen that drop off over the last month, but certainly I would imagine we'll see a little bit of an uptick as more individuals are eligible, both by age, and others have now moved into the yes, I'm willing to get vaccinated stage. A few reports here, a few other figures here just to show you. This figure 3 looks at Milwaukee County residents with at least 1 dose of any COVID vaccine. So we've also tracked in here the timelines that have been very important in the rollout of vaccines. So looking at when frontline healthcare workers were eligible, when 65 plus were eligible, and now recently adding the age 12 plus. So we're seeing that, yes, there's been a great uptick in some of our older populations in terms of total percent positive receiving 1 vaccine. We have a similar graph looking at completely vaccinated. And again, these rates are very high in our older senior populations, in the 50s, 60s, 70s, and not quite as high in the rest of the population, but certainly there's some room for improvement there. And then we also track the same data by race and ethnicity groups. So we see here that, vaccination remains very high in the white population. The second most vaccinated population group in Milwaukee County is the Asian subpopulation, followed by Hispanic and African American. And again, highlighting the needs to continue to reach out into these communities to drive up vaccination rates. So this figure looks at least receipt of 1 dose of COVID vaccine. And the second figure here looks at completely vaccinated by race and ethnicity groups. And the pattern is still very similar. So with that, I will end my remarks today. And I just want to, basically emphasize to parents and guardians out there of young adolescents and teens that there is a lot of vaccine available. And with the news this week that the Pfizer vaccine is now indicated and approved for those 12 through 15, we have another chunk of our young adults who are eligible for vaccination. And this is a welcome change, and it's one that's really going to help us move to higher levels of community immunity. So for parents of adolescents and teens between the ages of 12 and 17, just want to remind you, you need to seek out the Pfizer vaccine. The Pfizer vaccine currently is the only one licensed for those under the age of 18. And your options for finding this vaccine are plentiful. You can check with your provider. You can check with your local health department. You can check vaccinefinder.org to help locate providers in your community with Pfizer vaccine. And this could include health departments, this could include pharmacists, clinics, health systems, et cetera. The benefits for vaccinating adults for vaccinating children rather, are similar to those in adults. Once children and adults are completely vaccinated, they can safely interact without masks, with and without other vaccinated persons, as we've heard earlier in this briefing. Additionally, vaccinated children in a school setting are not constrained by quarantine restrictions if they have exposure to a positive case. So there's a lot of good reasons for parents and guardians to get their children vaccinated. Here in Greenfield and many other suburban communities, we're starting to open small clinics for school-age populations. I was happy to report that we set up clinics for the next couple Wednesdays here in Greenfield. And as of yesterday, there were very few takers, but as of this morning, all clinic slots were taken. And we recently expanded those clinics from about 80 doses to about 120 doses. So there definitely is some demand out there, and there's definitely availability for getting your teen vaccinated and your adolescent vaccinated throughout the county. So I encourage everybody to look into that as soon as they can. Thank you very much for your time and attention, and I'll now turn it over to Dr. Bensick.
Hi, thank you for having me. I am a pediatrician with Children's, and we are so excited about the news today that the kids are going to be able to be vaccinated from 12 and up. Children's has been doing vaccine clinics for our 16 and up since March 1st, and we are ready to go and start vaccinating the 12 and up kids. What Children's is doing is we've already been taking a wait list, and kids who are on that wait list, we will reach out directly to reach you and tell you about vaccine appointments. At this point, we are planning opening up 10 regions for clinics. They're going to range from as far south as Kenosha and go up as far north as Mequon, and then also extend west. We will also continue to offer vaccines at the main campus hospital. Parents, we strongly encourage you, if you have any questions regarding the safety of the vaccine, to please reach out to your pediatrician and let us talk you through it. I know a lot of parents have a lot of concerns about how quickly this vaccine was rolled out. It is very important to remember that all the proper steps were followed and that all the data was really looked at. They had over 2,260 participants in this study. And what they did is they randomized it. So half of the kids got the vaccine, half of the kids got a placebo. They also followed these kids up for 2 months. The side effect profile from this vaccine is very good. What we're seeing is they might have a sore arm, they might have a low-grade fever, a little muscle aches, but the majority of kids have done incredibly well with this vaccine and really haven't complained of any side effects at all. As mentioned prior, this is going to be the Pfizer vaccine only for the 12 and up age range. As we talked about, any vaccine, any place you can get it is good, but at Children's, we really want to help serve your kids. And remember that we will have in our clinics nurses, medical assistants, and also providers who are all trained in pediatrics and are trained in giving 12-year-old shots, which can be a little bit difficult, we know, for parents. I'm so excited about this. I can't wait for kids to get vaccinated so we can get kids back into their activities. We can get kids back into school, and we can really help kids start regain their life, which really was lost in this pandemic. I think parents, we really know how hard it hit our kids, and the mental health outcomes from the pandemic, which were completely unanticipated, has really been quite overwhelming. And anything we can do to help get kids back to normal is so important. The most important thing you can do to help keep your kids safe is to vaccinate them when it's available. So if you have a 12 and up child, we strongly, strongly recommend that you get your child vaccinated. If you have any questions for us, you can go to childrenswi.org/coronavirus, and we'll keep you updated on all the COVID-19 vaccines. And I just want to say again, thank you so much for having a pediatrician here. We are so thrilled about this, and we can't wait to get everyone vaccinated for you.
Thank you, Dr. Bensick. We're thrilled you could join us today. At this time, we'll move to the media portion of our briefing. And our first questions come from Sharon Bajenda with CBS 58, and they are for Mayor Barrett. The first question, Mayor Barrett, how often will the city be looking at metrics after June 15th? What criteria must go up in order for this health order to be reversed? Do we worry about cases possibly spiking in the fall, just like they did last year?
Well, that's a very good question. And I think we all recognize today in particular with the new guidance from the CDC that things as they have for the last 14 months can be very fluid and can change very, very quickly. One of the things that I'm proudest of, and I talked about this morning when we announced the lifting of the restrictions, is that at every juncture over the last 14 months, when we've made decisions as a city and when I've made decisions as mayor, I've followed the guidance from our health department, from the state, from the CDC. In other words, we've followed the science. And that's what we're going to continue to do. So what does that mean in practice for the city? It means that we'll continue to look at the different testing information we have, the vaccination testing we have, and we'll continue to analyze it literally on a day-to-day basis so that we can see what the trends are. This is why we're so thankful to the county for the work that it's done and the work that Dr. Weston has done. I think the information that we have had has been immensely valuable in helping us be nimble and make decisions rather quickly. But moving forward, what this also means is, in essence, we're putting the gating criteria to the side right now. And we are moving towards a version of new normal. And that means after June 15th, that organizations that want to have events, and I'm answering several of the questions right now, will not be required to submit safety plans. And you know, and you can see that there's going to be expanded capacity for a lot of events as well, including festivals. So that all will be post June 15th. In terms of the masks, there is an ordinance change pending that deals with indoor masking. And as we know from the CDC guidance today, it talked about the need is no longer there for individuals who have been fully vaccinated to be masked. So what I will do, because this news is less than an hour or two old, I'll be sitting down with our health commissioner and others in the health department to see what impact this will have, if any, on the changes we're looking for. What she had contemplated, and I've supported her in this, is that we go to the indoor masking and no longer have the outdoor masking per the CDC guidelines. I want to have a conversation with her to see how this changes in light of the CDC guidelines that have just, or the CDC recommendations that just came out in the last several hours. So there's a lot in the air right now, and hopefully it's all positive. But we will continue, as we have throughout the past 14 months, that whenever we make decisions, we'll be transparent in those decisions, and we'll share that information with the public and the media as soon as possible.
Thank you, Mayor Barrett. And yes, you covered off on a few questions. Just the follow-up to Sharon's question is, what would this mean for Milwaukee's summer festivals, and will it provide an economic boost for Milwaukee tourism?
For those events occurring after June 15th, again, you have the ability to go to full capacity. And I think you saw that, for example, literally within hours, the Brewers announced that they would go to full capacity at, I believe it was June 25th. I might be wrong on that date, but I think that that's what the announcement was. And that's in accordance with the actions taken by the city this morning. So will it be a boost in tourism? I'm guessing, and this is so much of this is tied up in human nature, I'm guessing that people will slowly feel more comfortable. I don't think it's going to be overnight where everyone's going to feel like they can go out like they did 2 years ago. But I'm hoping that it means that our restaurants and our movie theaters and other areas of entertainment will do better. Clearly, they've been hit very, very hard. So again, new version of normal, not total normal, new version of normal, with hopes that things will get even better after this.
Thank you, Mayor. The next question is from Courtney Sisk with WISN 12. She says, will Milwaukee County follow CDC guidelines regarding fully vaccinated people no longer needing to wear masks in most settings?
Thank you for the question. Well, this news is pretty much hot off the press. So we still want to be able to have some time to see what this means for our facilities and our county grounds. But when we get more information, we will share that with you.
All right, moving on to Allison Durr with Milwaukee Journal Sentinel. I believe several of these were answered. Allison, of course, feel free to chat if we need to follow up on any. But one is the mask ordinance remains in effect for the duration of the moving Milwaukee Forward health and safety orders. If the city is removing its phase from the website and lifting restrictions, does that mean the city's orders are no longer in effect as of June 15th? And therefore that the mask mandate as a whole, indoors and outdoors, would also lift?
Well, we've been in conversations with the city attorney's office because, as you correctly noted in the question, it is tied to the emergency order, and that obviously can be changed through legislation going through the Common Council. So that remains to be seen. I think the more pertinent question is, what is the impact of the CDC's announcement today on masking in general? And again, that is where, as I explained earlier, I will be sitting down with the health commissioner and others to see, okay, how do we move forward? What is the best way from a public health perspective to move forward as it pertains to masks? So stay tuned. The short answer is stay tuned.
Excellent. Another question from Allison is, when will the city begin the in-school vaccinations for children ages 12 to 15?
I'm sorry that the health commissioner isn't on the phone today. It might be as early as today. Look at this. Speaking of the health commissioner, Commissioner Johnson, when will we start doing the 12 to 15-year-olds?
We're starting next week. Oh, we're starting at schools. We started today at the Wisconsin Center and at the Northwest and Southside Health Clinics. And my own son got vaccinated today too.
Two things, 2 points there. One, her son didn't take skips. That's
Right.
And second, if you're anxious with your kids, if you're looking for something to do, bring them to the Wisconsin Center or the Northwest Side Health Center or the Southside Health Center. What a great way to spend time with your child.
Excellent. Madeline Anderson with Fox 6 is wondering, for anyone, are you worried these new guidelines will create confusion among businesses, workplaces, schools, etc.?
If you're asking me, I think there's going to be some confusion without a doubt. I don't know what you think, Dr. Weston. You turned yourself on. Why don't you comment on that?
No, I would agree. I think, the CDC guidelines are brand new, in the last hour or so. So it'll take a little time to digest. It'll take a little time to understand how these are going to apply to different settings, including businesses.
All right. Our next question is from Courtney Sisk from WISN 12, and it's for Dr. Bensick. She's wondering how many kids were on the children's wait list as of today?
I actually don't know the exact number. I know that we are going to offer over 3,000 spots over the next couple weeks. So I'm not sure what the wait list is at this point. I know it was filling up, but a lot of people were waiting for the final approval. So stay tuned. And if you're a parent, please contact your doctor. Let's get you on that list and let's get you vaccinated.
Thank you. Sari Lesk with the Milwaukee Business Journal has several questions for Commissioner Johnson or the mayor, is the health department continuing inspections until June 15th? And will businesses face fines for violations until June 15th?
Yes, we are planning to continue what we've been doing for the last month or so until June 15th. And similarly with the masking ordinance. However, given the news today, we are meeting internally to determine what that's going to look like. It does make it difficult to sort of operationalize. When someone who's vaccinated can be unmasked in public, in a public setting indoors, there's no way to know who's vaccinated or not.
A few additional questions. Will fines for mask ordinance violations continue past June 15th? And then
that's a great question. Again, dependent on what happens as we talk through the change from the CDC.
Why did the city choose June 15th as the date to lift the restrictions?
So we looked at our data and did some math around what if we continue the downward trend we've experienced over the last few weeks, what would that look like over the next 4 to 6 weeks? Recognizing we're moving into summer, people are moving outdoors, it's getting warmer. We're very confident that come June 15th, we'll be in a really good place to lift the restrictions based on our data.
And speaking of the data, Sari wants to know, how will the public be able to stay up to date about the status of COVID-19 transmission in the city after June 15th? And will that database remain public?
Absolutely. We fully intend to continue to track the data and make it public. Similarly, we'll continue to do contact tracing, positive case investigations, all the work we've been doing. The only piece that's changing is the orders and the restrictions that are in place.
Drake Bentley with the Milwaukee Journal-Sentinel is wondering for the mayor, with the Juneteenth festival set to be in person this year, what is the city's COVID expectations and requirements considering it is 4 days after the new order?
Well, just like any other event that will be occurring after June 15th, it will be in accordance with what we have in effect at that time. And at that time, we will not have this order in place. So Juneteenth Day festivities will certainly be able to go forward.
Sari Lesk with the Milwaukee Business Journal is wondering for the city, with gating criteria set to the side, what will guide the city's decision to potentially reinstate restrictions? Any specific threshold for disease burden?
That's a really good question. So we've been talking about what this will look like. And if you can recall, since March, we actually hit a pretty low burden number and a low test positivity rate early to mid-March. We opened up more fully, and we actually then saw an increase in cases. I don't have any interest in, the department has no interest in sort of reacting to these blips as they come and go. I think we're learning from how the virus is behaving in the population, and will not be reactive to a blip here and there, but we're really keeping track of the data. And if we get into a situation that looks like what occurred last fall, October, November, we certainly will reinstate restrictions. But again, have to remember that we're trying to get people vaccinated. So really hopeful that that won't ever occur again, and that we will be able to have, continue to move forward.
The next question is from Joyce Garbrisiak with WISN 12, and it's for Dr. Weston and Dr. Bensick. From what you know about the vaccine studies and testing happening on younger kids now, how likely is it that vaccine approval will come for kids younger than 12 before the start of the school year?
I can start here. So I'll say as a parent, I certainly hope so. But we are seeing vaccine trials in children as young as 6 months right now. As promising as the evidence was in 12 to 15-year-olds, 100% efficacy in 12 to 15-year-olds. I would expect and hope that we see similar results in younger age groups and that vaccine receiving authorization as soon as possible, hopefully, and I think not too unlikely, right around the time that school begins.
Yeah, I would agree with that. I think they're going into breaking up into the 2 to 11-year-olds first. But we'll have to see what the studies show. They're talking to us about September, October. So hopefully right in time for schools, because I know, going back to a couple earlier questions about what are we going to do with masking in businesses and schools, obviously a lot of that is going to depend upon the vaccination rate of our kids. And so that is another reason for parents to we're really pushing, think about vaccinating your kids. If the more kids we get vaccinated in the schools, the safer schools are going to be. Hopefully schools will be able to start, loosening up a little bit on the restrictions that we've put in place to keep kids safe so far.
Thank you both. We have a few follow-up questions from Allison Durr with the Milwaukee Journal-Sentinel, mostly for the city. I'll ask them one at a time. The first one is, will the city consider lifting its orders sooner than June 15th, given the CDC announcement?
Well, let me jump in. I'll let the commissioner talk about this first, but I think one of the beauties of these press conferences and one of the beauties of how we've operated over the last 14 months is people can see firsthand local government at work and how transparent things are. And I just checked my phone to see exactly when I got the word that the CDC had made this change, and it was approximately an hour ago. Not shockingly, I have not had an opportunity to speak to the commissioner or her staff about this in the last hour as we were both preparing for this call. But one of the things that she said and that I learned was that she's already begun the internal conversations with her staff. And the way it will work is that she will work with her staff, and then we will have a conversation, just as we have several conversations over the last 24 hours with my staff and her staff. So congratulations, everyone. You can see a local government at work here, and I'm proud of the way we do it. But clearly we're going to have conversations, but it's going to start out with a health experts meeting internally. That's my perspective. I'll turn it over to you, Commissioner.
Sure. So exactly as Mayor Barrett said, we are speaking internally, and then we'll reach out to his team and his staff and him to have a conversation about where this goes. But in terms of lifting our orders sooner than June 15th, I do not see that happening regardless of the CDC announcement. The CDC announcement is really specifically around masking. COVID is still present in our community. It doesn't change the fact that we're still in a high transmission. So we're not there yet. So I don't really see the June 15th changing.
And the next question is for Commissioner Johnson. She's wondering if you're able to comment on potential changes to the mask ordinance as it relates to the CDC guidelines as its basis in the city's health order, including how soon residents should expect further changes from what was approved today in committee. And are you hoping for a special committee meeting or changes at council this cycle?
So as Mayor Barrett said, I learned about it about 5 minutes before it was announced at 1 o'clock our time. And if you've seen that emoji with someone putting their head down on the table, that's how I felt after we just met at 9 o'clock this morning to have a conversation to change our current ordinance. So again, we're going to be meeting internally and talking about what this means for us.
Thank you. Madeline Anderson with Fox 6 is wondering, will masks still be required at Summerfest?
Similarly, same answer. We're working through this.
Next question from Courtney Sisk. To clarify, as of right now, masks are still required indoors in the city and county because the health department and city leaders have not met internally.
Correct.
Correct.
Excellent. Joyce Garbasiak with WISN 12 is wondering if there are any updates on the drive-through vaccination plan.
I can tell you that it will be the first week of June, and the announcement will be on June 1st.
Excellent. And the final question I'm seeing is from Sarah Lesk with the Milwaukee Business Journal, and she's wondering on what timeline, if any, might you expect full approval for the vaccines instead of emergency use authorization? If that occurs, do you anticipate schools requiring proof of vaccination?
So Pfizer in particular has applied for full approval of their vaccine from the FDA. They had to wait until 6 months of data had accumulated to apply for that approval. So they've done that. They're working with the FDA on that full approval. It typically takes several weeks for that to come. So we'll certainly watch for that. As to whether that'll create requirements, we've certainly heard from businesses and other organizations that is one step they'd like to see before requiring people to get vaccinated. So that'll be something to follow closely.
Excellent. Well, those are all the questions I'm seeing. I'd like to thank Dr. Bensick for joining us today. Thank you all for being on today's briefing. Thank you for the great questions. And that concludes today's briefing. We'll see you next week.
Thank you. Thank you very much.
Thanks, everybody.
Thank you.